What does this mean? A governor saying there are crimes involving the COVID-19 vaccine. What does this mean for public health in Florida?
Well, it's highly unfortunate that the governor has chosen to politicize vaccination, which has been one of the major discoveries, innovations in healthcare over the last 100 years, saving millions of lives. The COVID-19 vaccine is incredibly safe. While no vaccine is without some risks, the overwhelming data suggests that this vaccine is safe, prevents deaths, prevents hospitalizations, and is something that we should all be receiving to protect ourselves and our communities.
Is this just some scheme he's come up with to try to drag people into a grand jury and put them under oath where there is really no hint of anything criminal?
Well, I really don't know what the governor is planning to do with this kind of a tribunal, but certainly as a physician, I come to work every day to try and save lives and keep people healthy. And these vaccines do just that. I follow CDC guidelines because they're evidence-based. They're based in data that's been reviewed, peer-reviewed, published. And the overwhelming majority of those data show that this vaccine does exactly what we said it does. Prevents disease, it prevents deaths, it keeps people out of our hospitals. Look, we're in the middle of a triple-demic. We have children coming in with flu, children coming in with COVID, children coming in with RSV. Our hospitals are full, and we really don't have the capacity to deal with any more. And so if people care about our healthcare system, and they care about our frontline providers, they'll go out and get vaccinated because it's the right thing to do, because it's safe and it protects them and it protects others.
What happened, do you think, to this governor who sounded so pro-vaccine after he got the vaccine himself and is now suggesting that there's something criminal about the vaccine?
Well, I think it's what your last guest said. Clearly, this has become a political talking point for the governor, and unfortunately, that's what we'd expect of politicians. But when our Surgeon General, who's a physician, gets involved in that process too, it's particularly concerning. The recent memo that was sent out with guidance on vaccination for young adults was based on an internal report, an unauthored, non-published, non-peer-reviewed. That's not how we should be making public policy. And again, it's why I would refer back to the CDC. We are using guidelines that are, in fact, evidence-based, and that's how we should be practicing medicine.